Joining me now is Dr. Daryl Osbahr of Rothman Orthopedics, team physician for both the WWE and the Orlando Magic. So, Dr. Osbahr, when you address meniscal root injuries, what are some of the key things you look for to ensure a successful outcome for your patients?
Well, meniscus root injuries are a very tough injury for an athlete to come back from. So certainly the new technology we have has really been a game changer to really get our patients back at the highest level.
You recently treated a high-level college tennis player who had a meniscal root injury. Can you walk us through the injury, the treatment, the recovery, and how you were able to achieve a successful outcome with that patient?
One of the most important things with meniscus root injuries is actually to identify it. So in this specific athlete, actually, it was not identified early. So we took a lot of time with the athlete to make sure we had the right diagnosis. Second of all was having a procedure in elite athlete that could actually get them back in the most minimally invasive way. Because with elite athletes, it's so important to do things that are less invasive so they can get back to the highest functional level. And so the new technology we have in hand is really enables us to do that and then have a recovery that's built off of that platform to really expedite their ability to get back to play at that level. So in tennis, that's essential. The amount of workload it takes to play that at the highest level is significant.
And it's also very important when you can to preserve the meniscus. Can you explain why?
Yes, meniscus preservation is critical to cartilage health over time. And for an elite athlete, once you have meniscus loss and you develop cartilage wear, that's beginnings of arthritis. And so for a young athlete, especially at his age and the college tennis level that wants to go professional, so important to maintain the integrity of the joint.